infertility with assisted reproductive technologies is sort of rapidly increasing in the United States. And we were curious about the relationship between use of these assisted reproductive technologies, or ART, and stroke risk during the hospitalization for delivery. So it's important to note that this work really is focused just on that index hospitalization where the pregnant person delivers, not subsequent stroke risk or preceding stroke risk. And to sort of look at this, the events of stroke during the index delivery hospitalization, we conducted a retrospective study using population-wide data from the national inpatient sample, which is a big sample across the U.S. From 2015 to 2020, so pretty recent data, including all delivery hospitalizations for patients age 15 to 55 in that group. So in this big study, our primary outcome was all stroke. So that includes both ischemic stroke, hemorrhagic stroke, and we also included cerebral vein thromboses. And we compared patients who were had a code for use of assisted reproductive technology during that delivery hospitalization versus patients who did not have that code, so just other patients who delivered. And overall, we identified a very large number of delivery hospitalizations. Of those, about 200,000 or 1.1% experienced a stroke during their delivery hospitalization. And we found that there were much higher rates of stroke, all stroke, which was our primary outcome, in patients who had were coded as having received ART. But the incidence was 27.1 in 100,000 patients versus 9.1 in 100,000 patients. So the 27.1 per 100,000 was in the patients who received ART, and the 9.1 was in everybody else. And there were higher rates of ischemic stroke, hemorrhagic stroke, subarachnoid hemorrhage, though not cerebral vein thrombosis, which were our secondary outcomes in patients who had received ART. We adjusted for all comorbidities, so vascular comorbidities, age, other factors that are known to be associated with stroke in our analyses. And we found that even after adjustment, rate of stroke was higher in patients who had received ART than those who had not, with an adjusted odds ratio of about 2.14, and statistically significant. So, I think that it's very important to note some of the limitations of this study, which are many. And I think an erroneous conclusion would be to say, oh, ART is bad, let's avoid it. I think some limitations that we had is that the codes that we use to identify patients who had received ART are not well validated. They've been used in previous studies, but they haven't been compared in detail to chart review of patients, and that's a major limitation. Another limitation is that we don't know the timing of ART with regard to these delivery hospitalizations. It's entirely possible that somebody could have conceived having nothing to do with the ART they received years ago and still have had that code. So that's another important limitation. And, again, our focus really was on delivery hospitalizations in hospitals. So home births or patients who did not end up having a hospitalization for delivery for whatever reason were not included. So it really is a very limited study in that sense. I think the kind of practical takeaways are that in patients who are thinking about undergoing ART and have known vascular risk factors, that we should address those in kind of the established ways that we know how. Primary prevention for stroke is important. And I think that's kind of the biggest takeaway from this study. And I think more work needs to be done to understand the association that we saw.